Hi guys, if you've been watching our videos, you know by now that we're pretty excited about transcranial magnetic stimulation and have seen really strong results for our patients. But of course, TMS isn't for everyone. Coming up, I'll talk about 5 reasons why TMS might not be for you. Number 5 might be a reality check for some people. Stay tuned. Hi everyone, my name is Julia Swafford. I am a psychiatric nurse practitioner, and this is Real Talk Mental Health in Vancouver, Washington, where we discuss real mental health treatment issues from the provider's perspective. If this is kind of content that interests you, please click that subscribe button and that little bell, which will notify you when we release new videos. TMS, or transcranial magnetic stimulation, is an incredibly effective, groundbreaking treatment, but it's not right for everyone. Let's talk about 5 reasons why it might not be a good choice for you. Number 1, seizure disorders. The risk of having a seizure during TMS is very, very low, but if you have an active seizure disorder like epilepsy that you're currently receiving treatment for, you should not proceed with TMS. If you've had seizures in the past but don't have an active seizure condition, TMS is probably safe for you. You should get clearance from your neurologist. Seizures that have been caused by a specific trigger, like a high fever or detoxing off of alcohol or drugs, are not considered to be a seizure disorder. Theoretically, TMS could be safe for a person with a well-managed seizure disorder, even if it's active. And there are very early studies even researching TMS to treat epilepsy. However, current practice excludes people with an active seizure disorder from TMS due to safety risks. Number 2, active substance abuse. If a patient having TMS is abusing alcohol or drugs, or using more alcohol or drugs than they are telling their TMS provider, it places them at huge risk of having a seizure during TMS. Binge drinking or binge use of other drugs is especially risky. Most of the seizures that have occurred in TMS treatment centers when using standard treatment protocols have actually been caused by undisclosed substance use. So transparency about substance use is key in keeping TMS treatment safe and effective. There is growing evidence for use of TMS in treating some substance use disorders with protocols that are different than what's currently in use, and that's still being studied. Okay, number 3, off-label conditions or diagnoses. There are many conditions that TMS can help, but in the United States, depression, OCD, anxiety, and smoking cessation are the only ones currently approved by the FDA. That means if you are diagnosed with conditions like bipolar disorder, psychosis, schizophrenia, even if you also have depression, your health insurance will likely not cover TMS for you because these conditions are considered investigational. So if you had TMS, you would likely be paying for it yourself with a cash rate. TMS is also considered investigational or off-label for people under the age of 18. To be clear, this doesn't mean TMS wouldn't help or would be unsafe in these situations. It's just that the FDA has yet to approve these protocols and more research is needed. There is, theoretically, a risk of TMS leading to symptoms of mania or psychosis in people with these underlying conditions. But truthfully, this just doesn't happen enough for these conditions to be considered unsafe or contraindicated. They're just considered off-label from the FDA's formal approvals. Interestingly, in 2020, bipolar depression was granted something called Breakthrough Device Designation from the FDA, which is not technically an approval, but it indicates when something is supported by the evidence and is basically a fast track or expedited path for FDA review. Number 4, metal implants. TMS is not recommended for patients who have a metal plate or screw in or around their head. Titanium is actually okay. Braces and fillings in the mouth are also totally okay, even if they are metal. And they will not interfere with TMS treatment. Most pacemakers are also just fine. If a person can have an MRI, they are safe to have TMS, which has a magnetic field strength of under 2 Tesla, and that drops off exponentially with distance from the coil. I have seen health insurances deny TMS for people with implants like a vagal nerve stimulator, but really that is very safe with TMS and it can simply be turned off. So I appeal decisions like that because frankly, they're just not scientifically relevant or evidence-based. Okay, number 5, this one might be a doozy, but I'm just gonna be honest with you. You'll want to make sure that you are emotionally ready for TMS. I would suggest that you postpone TMS if you're just not ready to dedicate the time and energy into really getting better. TMS is a huge investment of time, money, and energy. Your time, your money, your energy. For those patients willing to dedicate themselves to the treatment, the payoff can be life-changing. Ask yourself how invested you are in getting better right now, really soon. Honestly, there's no shame if things are just too complex at the moment. Are you ready? Are you willing to make a commitment to getting to the clinic 5 days per week for 6 to 9 weeks? If not, TMS is not for you. Each daily treatment builds upon the last treatment. That's how it works. And patients who routinely miss treatments or take consecutive days off simply don't get much better. On that note, TMS will also work better if you're putting in extra efforts at home. The patients I've personally seen do the very best are the ones who are hitting their mental health from several different angles at once. For instance, picking up a new healthy habit, addressing a relationship issue, and my patients who go home and who veg for hours after each treatment just don't make much progress. I routinely tell my patients that TMS is the time to fake it till you make it, because TMS is literally changing your brain, priming it to receive better habits and thought patterns. But you have to give that input into your brain for it to take it on. Are you ready to get better? Maybe you're not in the headspace to really make changes. Sometimes people become invested in remaining ill, or they forget what life can be like in the absence of serious mental illness, or who they are in the absence of serious mental illness. And that should be addressed before starting TMS. Even positive changes in your life can be stressful. I've seen patients struggle with the rapid results and improvement they get with TMS. Their relationships change. Their brain isn't foggy or crowded with dark thinking. And the picture of health isn't always pretty. There might be serious issues that have been ignored. Sometimes maybe for a really, really long time, years. There's often a big cleanup needed after a depressive episode, literally and figuratively. Are you going to get up and do what you need to do to keep your brain healthy? You might feel more anxious. Are you going to use that body and use that energy? Are you going to reach out and be social? Are you going to find new hobbies? What will you do when you start to feel more emotions? What are you going to do when you start crying more? Are you going to start journaling? Are you going to start therapy again? Will you try to reconnect with your spouse, with your kids? Are you willing to be vulnerable? Getting and staying better will be really hard. And you've got to be ready as you can be, and get your support team ready too, because it is so worth it and you are worth it. I really hope this information has helped you as you consider if TMS is right for you. At our clinic, TMS Northwest, we've helped hundreds of individuals find relief from depression and other mental health conditions. If you're ready for TMS, we're ready for you. If you'd like to learn more, let's do this. We would love to offer guidance. And if you're in the Portland and Vancouver area, give us a call. We would really, really love to help you. Thanks for staying tuned, and watch out for our next video. Bye, guys.